to be the supine decompression exercise. This is an exercise that I give patients with an acute lower back pain. Maybe you're in spasm in the lower back, maybe you had a disc complaint, and it's painful to sit, it's painful to move, even to lie down. Lying down is going to be the safest, most effective position to be in when it's in an acute stage like that, because you're taking gravity out of the equation. So to do the supine decompression, we're going to be flat on our back. We're going to internally rotate the feet a little bit. So we're going to touch the big toes. The heels are going to be apart. This is called dorsiflexion, pulling the tops of the feet back. Pointing the toes is plantar flexion. I would argue we're in that most of the day because of the heels on our shoes. So we need more of this. And you're going to feel that in the shin muscles here. So big toes touching, heels apart, dorsiflex the ankles and the feet. Arms are going to be by your side. We're going to lift the knees off the ground an inch or two, squeezing the knees together. So that's going to fire up the adductors, the inner thigh muscles. So again, starting over, big toes, heels apart, dorsiflexed, knees squeezing, knees off the ground. That's the focus of the exercise. Hips down, squeezing here to pull the pelvis down will create more space in the lower back to heal that disc complaint. Then from there with the arms, you can either do this for some decompression breathing and just keep squeezing, or you can float the arms. So breath in. I'm putting a little bit of pressure here to activate the upper body. And then I float the arms just off my forehead. So not all the way down. Look at my lower back. It's arching too much. So we're here to here to here, and that's getting the body nice and decompressed, nice and long. Then from here we're going to float back, here, and relax. That's tough. You're really going to feel it here in the inner thigh muscles. So that was one repetition. That was a long rep. A normal repetition is going to look like this. Squeeze, dorsiflex, toes together. One. Good. I would do 8 to 10 of those. Okay, taking a break in between if you need to.